Understanding the data reporting requirements for the COVID-19 vaccine in Delaware. COVID-19 vaccination data is required to be reported in both Delaware's Immunization Information System, DelVax, and Vaccine Finder. The Division of Public Health's Communicable Disease Regulations mandate that all immunizations that are administered in the state of Delaware must be reported to the DPH Immunization Information System, known as DelVax. To request assistance in this, or to obtain the proper procedures, please call the Delaware Immunization Program Office at 302-744-1060. What is DelVax? DelVax is a confidential online computer system used statewide by doctors, nurses, and schools to keep track of their patient immunizations. It is a web-based, data-driven immunization registry system. The main purpose of this system is to meet the standard requirements for tracking and administering immunizations in a public health setting to ensure updated vaccination records on one platform. Additional information about DelVax can be found at the link in the description box below. What data is reported in DelVax? When your patients have taken their vaccine, it is important to update the following information on DelVax within their record: vaccine site or clinic, vaccine name, manufacturer, lot or serial number, expiration date, vaccination date, patient eligibility, dosage, body site, route. Health insurance may be subjective but ensure to include if required. Any adverse reactions. These also need to be reported on VAERS. If there is any additional information which is mandatory, please be sure to complete this. Ensure the NDC numbers match. New patient. COVID provider data entry. Ensure all enrollment steps have been completed. Proceed to log in using your credentials. On the home screen, verify the provider and clinic information is accurate. Perform search under patients to avoid duplication of patient demographics. Upon search, if no results are found, click the icon which states New Patient. Complete the demographics screen for the patient and input the following data: full name, date of birth, gender, and phone number. Direct data entry. Vaccines. Considering what information is required in order for you to successfully add what vaccines are available in your practice site will make it easier when completing patient records with their administered vaccine. Click on your name on the top right-hand side on the home screen. Click Clinic Vaccine Defaults from the drop-down menu. Click Search on the following screen. From the drop-down list, find the correct vaccine to be added. Here's a guide. VFC, Vaccine for Children Program. CHIP, the Delaware Healthy Children Program. Private, Vaccine for Privately Insured Clients. 317, Special Funded Vaccine Targeted for Adults. State, Purchased by the state. Ensure the NDC numbers match as per the vaccine box. Select the correct vaccine. Enter the lot number, expiration date, funding source, and route of administration. Once the vaccines required have been added, click Update in order to update the clinic's vaccine registry. Considering the importance of data collection around race and ethnicity, data can be collected by leveraging EMR systems to ensure the race and ethnicity data for your patients, both new and existing, is up to date, using the data to address healthcare disparities, monitoring and ensuring quality of care for all patients, and as providers, it's important to ensure patients are aware that all data will be private and confidential. All providers are required to accurately report race and ethnicity data for all immunizations, including COVID and non-COVID vaccines, and for patients of all ages. Providers must explicitly ask the patient what their race and ethnicity is, and ask follow-up questions as needed to ensure collection of correct data. Accepted race categories include American Indian or Alaska Native, Asian, Native Hawaiian or other Pacific Islander, Black or African American, White or Caucasian, other race, and unknown. Accepted ethnicity categories include Hispanic or Latino, not Hispanic or Latino, and unknown. If a patient reports one or more of the accepted race and ethnicity categories, select the corresponding race and ethnicity category or categories. If a patient declines to disclose their race and ethnicity upon being asked, select Unknown. Providers are required to ask all patients for their race and ethnicity. If for some reason the provider fails to ask the patient for their race and ethnicity, leave the field blank. Do not default to Other Race and Ethnicity or Unknown. What is Vaccine Finder? Vaccine Finder is an online free service that is updated daily. Users can search Vaccine Finder for pharmacies and providers that are offering COVID-19 vaccinations. The information is provided directly to Vaccine Finder by the providers and pharmacies. Vaccines.gov is powered by Vaccine Finder. What information is reported to Vaccine Finder? Inventory reporting of all COVID-19 vaccines on hand is required for all providers daily. Optionally, if there is enough supply, providers may choose to make their locations visible in Vaccine Finder. This would allow the public to find provider locations that have COVID-19 vaccines available. Reporting COVID-19 vaccine information in Vaccine Finder. Step 1. Enrollment. Providers will receive an enrollment email from Vaccine Finder at auth.castlighthealth.com. This email contains a unique link that will expire in 7 days. If you cannot locate the initial email, you can reach out to Vaccine Finder at castlighthealth.com. If the link has expired, please contact the help desk. Step 2. Create an account. To create a COVID Locating Health account, providers would use the email address where the registration email was received as the username. You would then need to create a password and answer the vaccine selection and reporting designation questions. Then save the information to create the account. Delvax Public Portal Access. Delvax is a confidential online computer system used statewide by doctors, nurses, and schools to keep track of their patient and students' immunizations. Through the Public Access Portal website, parents and legal guardians can print official immunization records for their child or children ages 0 through 17 years. Adults ages 18 years and over can print an official immunization record for themselves. Easy steps to finding a record through the Public Access Portal. Visit the Delvax Public Access Portal. Enter the last name, first name, date of birth, gender, and relationship to the person whose record you are searching for. Choose either text or email and proceed to enter the cell phone number or email address and click Search. Once the record is found, click Request Code to access immunization record. You will receive an access code via text or email to enter on the verification code screen. Click Verify once the access code has been entered. Print and/or save the official immunization record. Please allow 1 to 3 business days for records to be updated in Delvax. Responses to emails and calls received after normal business hours and on weekends may take up to 48 hours to occur. Feel free to contact the immunization program by calling 800-282-8672 or by emailing delvax@delaware.gov. If you have any questions, please reach out to Lori Saul at Quality Insights.